Hello and welcome to this Living Well with Myeloma session on emotional and psychological support for anyone affected by myeloma. So it's perfectly natural for anyone affected by myeloma to experience some emotional and psychological issues. And in this webinar I will explore some common experience around what can happen at diagnosis. I will look at how relationships can change, at ways of coping and what support is available. And we'll explore how the myeloma itself and some of the treatments can exacerbate negative psychological and emotional feelings. So looking to the diagnosis to begin with, it's a natural reaction to feel overwhelmed when given a diagnosis of myeloma. However, everyone will react to the news in a different way. It is well documented that men do respond to and deal with emotional issues in a different way too. A lot of men still feel the need to put on a brave face, suppress their feelings and are very, very stoic. This can have consequences for them in terms of not accessing support, and it also means that they're less likely to report symptoms, side effects to their myeloma treatment. So the diagnosis is made, you're told you have a cancer which you've probably never heard of, which is incurable yet treatable, and that with strong medication there's a chance of plateau or remission, and that you can experience several periods of relapse and remission. So it's no wonder that many, on being given such a diagnosis, will feel overwhelmed and have strong feelings of fear, anxiety and shock. Some will hear the word cancer and nothing else. Many describe feeling numb. For some, these feelings give way to anger and frustration. Initial thoughts may be around, why me? Am I going to die? And that life from that moment onward has changed completely and will be full of hospital visits, words you've never heard of, and potential nasty treatments. How the diagnosis is given may well play a part in how you react. Some doctors are very good at breaking such news and have done it several times before and are skilled at doing it in a very sensitive manner. Whereas others perhaps don't have such good communication skills and the delivery can seem insensitive or harsh. It may sound surprising, but some patients will actually feel a sense of relief at the diagnosis, that their symptoms have an explanation. They may well have been going back and forward to the GP with no clear explanation, and some even begin to wonder if it's all in their imagination. Relationships can become strained. So we've said that relationships can become strained, so let's look over the next few slides at how the diagnosis of myeloma and living with it day to day can affect relationships. So first of all, looking at telling loved ones. The thought of telling loved ones, family members, friends, can be quite daunting, and some people put it off for as long as possible, all the while the initial anxiety is building up. There are ways to break bad news in a sensitive manner, but it is important to do it. It would be devastating if a loved one found out from another source or by accident. Many patients tell me that they are surprised at the reaction of loved ones on being given the news. People who were thought to be unlikely to cope or to deal with it well have shown to have an inner strength and have reacted with determination to find out more and to know what they are dealing with in order to better support the patient. Others can react differently. There may be tears, there may be anxiety, there may be denial. It can take some people some time to get their head around things, to be able to cope with the news. So some patients ask about telling children or grandchildren. This can be quite tricky, but again, it's often better to do it than to ignore it. But it can be difficult to know what to say, when to broach the subject with children and what to say. We know that children can often be more observant and resilient than we sometimes give them credit for. And as there is a possibility they may pick up clues from family members that something is going on, it's generally recommended that they are kept involved in some shape or form. It's often best to talk to children in an environment they are comfortable in. For example, if you often sit down together to watch television, use that time to talk to them about myeloma before turning the television on. Speak to children when you're doing something you ordinarily do, and it can often lessen the stress. It is important to put things in simple terms for children and to repeat key points. Pictures or diagrams may help them to understand. Try to keep them up to date with what is happening with as little or as much information as you see fit. This will make sure that they feel involved and will help to stop feelings of exclusion. Give them the time and the opportunity to ask questions or to say how they feel, but don't force them to talk about it if they don't want to. There are several resources to help when talking to children, and at Myeloma UK we have a booklet called Kelsey and the Yellow Kite, which helps to explain about myeloma to very young children. So from the day of diagnosis, you will begin to build up relationships with a whole range of healthcare professionals, with the consultant haematologist, with specialist nurses, with the phlebotomist who takes your blood, and with others you come into contact with at the hospital in the course of your treatment and care. Of course, we're all human with different personalities and characters, and there can be clashes which can lead to a breakdown in a relationship, perhaps through no one's fault particularly. If this does happen, it's likely just to be a temporary thing. Minor misunderstandings can happen in any relationship, and it's often best to get things out in the open and address any issues as and when they come up. Don't allow them to become more than they are. The healthcare professionals in your team are there to try and make sure that your experiences are not harrowing or unpleasant, and they will do their best to ensure that this is the case. But of course we all have off days. Mostly though, doctors and nurses are able to leave their personal feelings to one side and behave in a professional manner. It's a good idea to get to know your team, to take a note of important contact details and know who you can contact with your concerns, especially outside office hours. So you will also come into contact with other patients and their families and friends, and many find that sharing experiences and talking through similar situations is a great form of support. So you may find that you begin to build up relationships with others in a similar situation to yourself. Whilst this isn't for everyone, many do tell us that joining a support group or contributing to an online forum really helps relieve feelings of isolation. Others say that helping others within these platforms gives them a sense of well-being. I will go into a little more detail in the next few slides around what you can do to help yourself. So the next couple of slides, I'll just dwell on this one for a second or two so you can see what's to come. So the next few slides are going to be looking at the ways of coping. So we all often hear that information is power. Becoming informed can certainly make you feel as if you're taking back some control. Many feel that when they are diagnosed with and being treated for myeloma, that any control is taken away from them by hospitals, by doctors, by nurses, and by the regular appointments they have to keep. So anything that gives you back some sense of control is only a good thing. Becoming informed also helps you to know what you're dealing with, what questions to ask your healthcare professionals, and allows you to have some idea about what to expect. It also helps you to identify what signs of changes in mood could be as a result of becoming depressed or due to treatment-related side effects or myeloma complications. For instance, we know that steroids can cause mood swings, in some cases quite extreme mood swings. So if you're already feeling low or anxious, steroids may make these feelings worse. And in some rare cases, it can lead to a clinical depression. It may also be helpful to know, for instance, that it's fairly common for patients post-stem cell transplant to take a dip in mood. And again, if you know that this may be an issue, then perhaps it won't take you as much by surprise. At Myeloma UK, we have a range of information to help you become fully informed, which you can see on your screen just now. One service is our Info Day programme. These are day-long meetings which give you the chance to hear from experts and meet others affected by myeloma. We run these days because we feel everyone should have the chance to hear about the latest myeloma treatments and research direct from doctors and nurses, and to meet others in a similar situation. Our Info Days have a positive, supportive atmosphere with lots of opportunities for attendees to ask questions and share experiences. It's also important to become informed about other things over and above the myeloma which may be contributing to increased stress levels. So if you're worried about finances, talk to someone at the hospital social work department or to a Macmillan nurse, someone who has expertise in this area and who deals with issues which may be concerning you on a day-to-day basis. You can also talk through any concerns you have around your employment, clarify what you may be entitled to and what your rights are. Many patients do cope better when supported by others, and it's worth bearing in mind that the National Institute for Health and Clinical Excellence guidelines state that given emotional support is a key role of the clinical nurse specialist. So your nurse specialist isn't just there to help manage your treatment and care and to provide information, but they are also there to provide emotional and psychological support. Talking to other patients and carers who may have been through what you're going through, who may have had similar experiences, is a great source of support. And whilst they aren't for everyone, many find support groups an excellent source of support. Attending a support group can relieve isolation and help you realise that you're not facing your journey alone. Some people may prefer the anonymity of online forums, but again, these are supportive platforms to share experiences, to be supported and to support others. There are many online discussion forums around, and there is one on the Myeloma UK website, so do have a look at that. There's also a closed Facebook page set up by a patient, and I know it's a very busy page. Please do call the Myeloma Infoline as well. I answer the Infoline with my colleagues Debbie and Jude, and we can provide practical advice, emotional support and a listening ear. We can help you understand myeloma, its complications, discuss treatments and side effects, and we can clarify things you aren't sure of, in many ways taking the mystery out of myeloma. So please do call. There are no time limits to calls and they are confidential. Relaxation and maintaining a level of positivity will help with anxiety. But please don't beat yourself up if you do have the odd off day. It's perfectly natural and you can't be expected to be upbeat and positive all the time, especially when things go wrong, a relapse occurs or you develop treatment-related side effects, for instance. Complementary therapies such as gentle hand or foot massage, reflexology, learning relaxation techniques can be very useful. These and other therapies such as music or art therapy may be available at centres attached to the hospital. Do ask if there is such a centre near you that you can access. Most of these centres also welcome family members as well as patients. It's really important if you can continue to enjoy what's important in your life. That may be gardening, exercise, maintaining strong family ties, or keeping up attendances at the church. These activities can help you cope day to day with the challenges of living with myeloma and improve your feelings of well-being, relieving your stress and anxiety, and keeping the enjoyment in life. So moving on to finding support now. Healthcare professionals recognise the importance of psychological and emotional support in addition to providing treatment and care. And as I said earlier, this is reflected in the NICE guidelines for myeloma, which do recommend that patients are offered prompt psychological assessment and support throughout their journey with myeloma. This may mean referral on to other experts such as counsellors or clinical psychologists. So do feel if you need to ask for if you need extra help, do ask to be referred. It can be quite a big step to actively look for support, and it's known, as I touched on earlier, that men in particular are not good at seeking support. However, once you take that first step, people tell us that they wish they'd done it sooner, or they had no idea the range of support that was available. Many hospitals do have cancer centres or Maggie centres attached where you can access some complementary therapies. Do ask about this if it's something that you think you would benefit from. We have a list of myeloma support groups which you can access on our website, or we can send you an info sheet with the details of support groups in your area. We also have patients and families who volunteer who have said they're happy to talk to others in a similar situation. Do let us know if this is something that you would find helpful. So please also bear in mind that some of the complications of myeloma or the side effects of its treatment can also have an effect on your emotions and mood. For instance, pain and fatigue can make you feel very low in mood and can increase anxiety. Sleeplessness certainly doesn't help, and it can be difficult to get a good night's sleep when you have so much on your mind, or if steroids are causing sleep disturbances. Please bear in mind that sleeping tablets certainly have their place, and are often a helpful solution short term. As well as potentially causing sleeplessness, we know that steroids can cause mood swings, as I've already mentioned, and they can be quite severe. So I speak to patients and family members regularly who say that steroids have had an effect on their mood. They can cause you to feel very high and full of energy when you're on them, but then when you stop, your mood takes quite a dip. It's a bit of a withdrawal type effect. If steroids are affecting you, please do let your doctor or nurse specialist know. There is often much that can be done to gain the balance between effective myeloma treatment and side effects. Thalidomide and some of the stronger painkillers can cause drowsiness, and this in itself can create a change in mood. Again, it's important to report any side effects. I said earlier that a diagnosis of myeloma can instill feelings of anxiety and fear, and that everything is changing. It is true that your life after diagnosis will be different. It will take time to get used to the new normal, if you like. You will need to become knowledgeable, to become informed, and to perhaps be particularly thorough when planning holidays and activities, for instance. Your routine will be changed. That said, most people do adapt quite quickly to the new normal, with some help from family and friends and healthcare team looking after them. Let's move on to look at the resources available. So that's the end of my presentation. I'll pass you back on to Rebecca.
Okay, so we should be going on to our questions now. We'll just wait for the first one to load. Okay, our first question comes from Diane. She says, my partner's mood swings are very difficult to deal with. I'm seeking emotional support, but would counselling or cognitive therapy help him too?
It probably would, Diane, yes. They certainly do have their place. And you know, I've touched on a couple of times that men aren't really very good at seeking support from themselves, for themselves. However, and many do tell us that once they take that first step, once they actively seek help, then they wish they'd done it sooner. Counsellors within the hospital, if you're referred to a clinical psychologist from the hospital, if your haematologist or nurse refers you, they are often very knowledgeable, if not on myeloma, then the anxiety and the particular stresses caused by haematological conditions. So they may well have some knowledge. Cognitive behavioural therapy is something that many counsellors use as a form of counselling, and it allows you to take some control. It's not a one-way thing though. You don't turn up to a counsellor and get fixed. It's a collaborative thing. It happens over several meetings, and you do have to do a bit of work as well. So you will be asked, for instance, to keep things like diaries, and to think about turning perhaps irrational thoughts into more rational ones, and you'll be guided as to how to do that. So absolutely, I would say if you're struggling, counselling, and perhaps a counsellor who specifically uses cognitive behavioural therapy is a good thing.
And what about the difference between counselling and CBT? Is that something that, you know, certain people react to in different ways? Is this something that, you know, if they're going to go to get CBT or counselling, is this something they need to get referred to?
Yeah, I mean, you can refer yourself. There is an association, the British Association for Counselling and Psychotherapy, which you can access online, and there you'll see a list of counsellors in your area, and you can pay, I think it ranges from £12 to £20 an hour to get some counselling, and you can see what kind of counselling your particular counsellor does. And as I say, there are different types. I think the one of choice in the NHS is cognitive behavioural therapy. It's been found to be very effective for anxiety, for depression. So I think that's probably the one that most NHS counsellors would recommend. But if you wanted to seek one privately, then you can certainly do that. Yeah.
Okay, thanks, Ellen. I hope that answers your question, Diane. Our next question comes from Daniel. You mentioned Macmillan Centres, Ellen. There is one near me, but I'm not the patient. Can they support me too?
I certainly would hope so, yes, and it wouldn't do any harm to go and ask. You know, we know and we're well aware at Myeloma UK that myeloma affects everyone, not just the patient, carers, family members, friends also need to be supported too, and that's why we are developing quite a large resource for carers and family members. But yes, you are certainly affected by your partner's diagnosis or by your loved one's diagnosis, and it may well have emotional and psychological effect on you. So if the Macmillan Centre near you doesn't support you, and I don't see why not, if I'm honest, I should think they probably will, then maybe speak to one of the nurse specialists at the clinic that your loved one attends.
I've often heard people within Myeloma UK saying that a lot of the family and friends of patients often struggle to come forward for help because they feel they shouldn't necessarily be the ones who are seeking help compared to the patient. Have you found that with informal?
Yes, they do. But we know from support groups, we know from info days that it is really important to support the carer. But sometimes carers do feel as if they're being fraud. I'm not the one that's been diagnosed, so why do I need help? I feel like a bit of a fraud. But you absolutely are. It's not at all. In fact, we often say that sometimes the carer has a bit more to cope with. You've got to become fully informed yourself about a cancer that you've probably never heard of either. You've got to field calls from other family members and friends and to know what you're talking about. You've got to make sure appointments are up to date, diaries are up to date. You've got to make sure that you have all your contact details in an accessible place. So the carer certainly has quite a lot to take on, and they do need support as well. So please don't think that you're not entitled to it. You absolutely are.
Okay, thanks so much for that, Ellen. We're still taking your questions. If you want to submit, just go to the webinar window and click on the questions tab. And remember, if you're on a smartphone, tablet or something like an iPad, just click on the question mark icon and you'll be able to submit there. Okay, our next question comes from Julian. Regarding feeling low after stem cell transplants, is that due to physiological reasons, mental, a reaction to medication, or because of the whole ordeal?
Well, Julian, it's probably a combination of all of those things, I have to say. And mostly I think it's because when you're in hospital having your stem cell transplant, and you will be in hospital probably for between 2 and 4 weeks. You're surrounded by doctors and nurses. They're taking blood from you every day. They're taking your recordings, your blood pressure, your pulse. You're getting a lot of input from healthcare professionals. And then when you're discharged home, for the first wee while, again, you'll be monitored very, very closely, probably on a weekly basis to begin with. And then after about 2 or 3 months, if everything's going well and your myeloma's stable, then your appointments with your haematologist will probably drop down to every month. And it's usually after about 2 or 3 months that patients tell us they can feel a sense of abandonment, and they begin to have more time to think about the ordeal that they've actually been through. And it is a very traumatic thing you've just been through, the admission to hospital, the having the transplant, and whether or not you physically struggle, psychologically and emotionally, it's a huge thing. So yes, it's very common about 2 to 3 months after a transplant. Mostly patients just take a wee bit of a dip in mood, and their nurses are able to say, yeah, this is something we hear about all the time, you're not alone and it's not unusual. And that allows them to think, right, okay, well, we need to just be looking forward now. But if it becomes more serious, if you are feeling like you're perhaps actually becoming depressed, then you need to speak to someone in a bit more depth. But it is a sense of abandonment. We've had a lot of input from doctors and nurses, and then it stops. So it's not surprising really that you struggle a wee bit. Yeah.
Thanks, Ellen. I hope that answers your question, Julian. We'll just move on to the next one now. This one comes from Sarah. She says, I don't know anyone with myeloma and I would love to meet up with other patients. How can I find out who lives near me and how to get in touch?
Well, there might well be a support group near you, Sarah. So as I've said, we've got an information sheet with all of the support groups we're aware of in the UK. Sarah Morgan here at Myeloma UK runs our support group programme. It's also on our website. If you go onto our website, there's a map. You can click on your area and see if there's a support group in your area, and you can click on it further and find the details of the group, who the support group leader is, when they're having meetings, who they've invited along to their meetings. So there might well be a support group in your area. If there isn't a myeloma specific group in your area, there may well be a cancer support group, and people like Macmillan might well be able to tell you if there's a cancer support group. And ask at the hospital as well. It's something they probably get asked on a regular basis. So don't worry about saying to the doctor or nurse specialist, is there a support group in my area? And try the online groups. They are very useful. People ask questions, they introduce themselves, they share their experiences, and they kind of chat to each other online. So do have a look at those as well. Or give us a call on the info line and we can maybe go into a bit more detail about what's available for you.
Yeah, I hope that helps, Sarah. We can send you out quite a few of those links to try and get you connected with the local support group or one of the online groups as well, and hopefully we can find you some patients near you. We're still taking questions at the moment. Once again, just remember you can go onto the tab of the questions section of the GoToWebinar window or the question mark icon on your smart device. Okay, so we have another question. This one comes from Wendy. She says, what I find difficult is mixing with my friends and family in the normal world. How do I get the right balance between acknowledging my disease and current treatments, but not feeling totally cut off from conversations about holidays, pensions and old age?
That's a good one, Wendy, and it is difficult. I mean, I often hear from patients that on the outside they look perfectly normal. To look at someone with myeloma, you wouldn't know that they had myeloma, but they are dealing with this this diagnosis and living with it day to day. So but there is certainly the possibility of getting back that sense of normality, and if if your myeloma is under control and you get back to your hobbies, your coffees, your lunches. It's a bit of a slow process. It doesn't happen overnight after the diagnosis, after you've been on treatment. You will feel a bit of a sense of detachment perhaps for some time, but slowly but surely we do hear that people are able to get back to that level of normality, but and are able in many ways to put myeloma a bit on the back burner as they call it. So but of course you will have your regular appointments and it will always be there at the back of your mind. But don't worry about bringing it up with your friends if you're going out for lunch or having a holiday conversation. Say, well, I might have a few problems getting holiday insurance because I've got myeloma, and bring it into the conversation. Make it normal. It is something that you're living with day to day, so it's your new normal.
Okay, I hope that helps, Wendy. If you do ever want to talk about what you're going through, you can always call on the Myeloma info line. We'll be giving that number at the end of the webinar again as well. Okay, our next question comes from Andy. Olympians visualise their success. Can patients improve their mood by visualising or focusing on positive thoughts?
Yeah, I know quite a few patients who do that, yes. But it's a bit unrealistic to expect someone to be positive all the time. So I think I mentioned earlier, it's a bit much to expect someone who's been diagnosed with a rare cancer to be positive at all times. You just can't sustain that level of positivity all the time. And don't beat yourself up for having the odd off days. But yeah, things like visualisation, relaxation are often complementary therapies that some of these cancer centres have classes or sessions for. If you have got a Maggie Centre or a Cancer Information Centre or a Macmillan Centre, they may well have sessions for these techniques. And again, it's something perhaps that some counsellors will talk about. So if you wanted to find a counsellor, again, maybe a private counsellor, and go to the British Association for Counselling and Psychotherapy. but a lot of people do find visualisation a good thing. But as I say, don't beat yourself up if that's not you, and if you don't feel positive at all times. It is useful, and if it works for you, that's the best thing about it, probably.
Okay, Andy, I hope the positive thoughts are helping you, and thank you for your kind of real related question. It's nice to see. I think we're just going to probably take maybe one more question. Please put in your questions if you still have them. And I think we've got a comment here. My GP initially puts me in touch with another myeloma patient, obviously after speaking to both parties in advance. This was the first time I met another patient, and it was very helpful. Thank you for that, John.
Yeah, it can be very helpful, and we do have a programme. It's called our peer programme, which is our patient experience exchange resource. So we have a list of volunteers, family members, patients who have said they're happy to talk to others on the phone. I have to say, in my experience, most patients want to speak to another patient who's been through a stem cell transplant. That seems to be the thing that people worry about mostly. So if you ever do want to speak to another patient, I can sometimes match you up with someone who's perhaps had similar experiences, and you can do that at support groups as well. Support groups and the peer exchanges, as we call them, are often very positive platforms. They don't focus on negativity, although again we would always say that it's inevitable that there will be times when the mood of the group is very low, if they've had a few setbacks, if someone's become very ill. So yes, speaking to someone else relieves feelings of isolation, allows you to know you're not alone, and there is help out there.
Okay, thanks very much for your comment, John. On top of questions, if you ever do feel like adding your comments and contributing to the conversation, feel free. You can do it in the same way we've been discussing. Okay, so I think we've roughly got just maybe one question left at the moment, so I'll take that just now. This one comes from Emma, and it looks like a bit of a long one. Huge difficulty for me as a wife and a carer to a myeloma patient just getting ready for a stem cell transplant. It can feel like a limbo, and that we will now spend the rest of our time together watching and waiting for the next deterioration in my husband's condition. He's young, and the fear he may not get to see the milestones for our children often feels crippling. Any tips on getting past this fear?
Yeah. That is a huge thing. I mean, we often hear that, for families, for patients, myeloma, especially soon after diagnosis or soon after transplant or at relapse, or when you're preparing for a transplant, myeloma is the last thing you think about at night and the first thing you think about in the morning, and it takes over your life. And I know it may not feel like it at the moment, but that will improve. And I hear so many patients on the info line, and I say to them, I'm going to refer to your experience because it's a good one, who have had a very, very difficult diagnosis, who didn't see any light at the end of the tunnel then, and now 2, 3, 4, 5 years down the line are in a different place. I mean, it is possible. In the meantime, certainly I think getting some extra help might well be useful for you, Emma. So maybe some family counselling, speak to a clinical psychologist at the hospital your husband attends. There may be some extra support for you all together there, but I know it can feel like now your life is just being ruled by the myeloma and the treatments and the hospital appointments. And yes, because we know myeloma is a relapsing and remitting cancer, for instance, if someone's in remission or in good plateau, the monthly appointments are dreaded. Is this going to be the time that I'm told that it's relapsing? And it's always there, and it's a huge sense of relief when they come away from their appointment and they're told that their myeloma is still stable. So there will be periods where it's worse than other times, but there will also develop to be long periods where it's not such a huge focus. But seek help, and even if you don't need input just now from a clinical psychologist or a counsellor, it wouldn't do any harm to be introduced to someone to be given some tips about coping, about solutions, about changing irrational thoughts to rational ones, and about dealing with these issues, and maybe they can be picked up on at a later date when needed again. It's not a one-off, it's something that would be a continuous thing.
Okay, thanks very much, Ellen, and thank you for sharing, Emma. We know quite a few of you will be watching today and not necessarily want to submit your questions onto the webinar publicly. We'll be sending the information for the info line and our Ask the Nurse email service as well if you're wanting to get some advice and ask your questions after the webinar. We've got one more question which we're going to take, and we'll be finishing just a little bit earlier than planned. Our last question comes from Barry. He says, I've had myeloma for 5 years now. I enjoy taking my dogs for walks and find this helps me, but I feel physically very weak and get breathless very quickly. I try to counter this by pushing myself, generally by walking up gentle hills, until I feel I just have to stop. I do seem to recover quite quickly with pulse returning to normal within about 2 minutes. Is this a good idea, or am I being foolhardy?
I don't know that you are being foolhardy about it, but I do think that any new or increasing symptoms should certainly be reported to your doctor. If this weakness and breathlessness is something new, your doctor will want to know about it, just to make sure that you're not becoming anemic, for instance, because anemia can commonly cause a shortness of breath, especially after some exertion. But if this is something that you've always had in the 5 years and it's not something new, then I think a gradual increase, a gradual progression of your exercise levels is better than really pushing yourself over that wall, as it were. So start off by pushing yourself for an extra couple of minutes, and then for a week or so, and then pushing yourself a little bit further. But any new or increasing symptoms, stop what you're doing and let your doctor or nurse know. I wonder if you are maybe a wee bit anemic, Barry, and certainly that's something that needs to be checked, because that is a common, what you've described is common in anemia. So, and if you are anemic and symptomatic of that anemia, then maybe there's something that the doctor or nurse can do to help. So do ask about it.
Okay, I hope that helps, Barry. Thank you very much for your question, and thank you for everyone who submitted their questions today. As we said earlier, if you do feel like you want to submit a question or speak to someone about what you're going through instead of putting it up onto the webinar, you can do so by using the Myeloma info line. That number is 0800 980 3332. You can also submit a question to our same myeloma information specialists by using our email service. We'll be also sending a link out to that, but you can see it on your screen at the moment. It's askthenurse@myeloma.org.uk. And I think that's all we have time for this session. So we hope you found this helpful, and we hope to see you again soon.